Welcome back to National Report. On the cover of The Atlantic, the headline reads, "California has lost control." California is on the verge of breaking a pandemic record from the darkest days of spring. Not that long ago, it was looking better than most of the country. So where did the Golden State go so wrong? Joining us to discuss is Dr. Jason Wilson, Associate Medical Director of Tampa General Hospital. Doctor, thanks for coming on today. As we know, there are some of the strictest lockdown measures implemented in California, and yet these cases are surging. The lockdown's not working. What's really going on here?
Well, what we're seeing is a stark reminder that even though we're 10 months into this virus and we're all very sick of this virus just doesn't care. You know, overall in the United States, November, December have been some of the worst months for hospitalizations and mortality. And if you look at California specifically, positivity rates are up and there's more testing. The positivity rates are up with that, and hospitalization rates are indeed very high. Overall, we know that public health measures do work, but you also have to look at the specific area you're thinking about. So we know there's a lot of variation between states in this country in terms of what measures we're employing and when and how long we employ those measures. And also within California itself, a lot of these cases are in LA County or even east of San Francisco, where you have a lot of service workers and people who are deemed essential workers. And we see that gap really widening between essential workers getting more and more of the frontline hits of this virus as we go forward. This just echoes the fact we got to get this vaccine rollout moving at breakneck speed.
Yeah, absolutely. We know that Pfizer and Moderna are on their way out. They're being distributed to these hospitals, and we are seeing the first dose of vaccinations go into people's arms. But I want to talk to you again about these lockdown measures. Do you think part of it has to do with people just being so tired of being restricted and cooped up for so long that they're just kind of saying, I'm done with it. I can't do this anymore?
Yeah, and if you look at California specifically, we know that the cases did start to rise before the holidays, but have certainly accelerated during and after the holidays. We're starting to see home gatherings be another epicenter of viral spread. Again, echoing your point that people are just really over this. And unfortunately, biology and chemistry just doesn't work that way. The virus just doesn't care with the fact that we have lives that we want to live and have work that we need to go to. And I go back to that as well. It's really, people who have to go to work and have to, find ways to pay bills and do those types of things. We're seeing those populations get hit hardest by this virus and by those numbers as hospitals really struggle to find places to put them because people are getting very, very sick from this virus as well.
I want to talk to you about some other numbers, those being the COVID death count. President Trump had weighed in on this. He tweeted this and his concerns, saying the number of cases and deaths of the China virus is far exaggerated in the United States because of CDC government's ridiculous method of determination compared to other countries, many of whom report purposely very inaccurate and low. When in doubt, call it COVID. Fake news, end quote. I want to play you what Dr. Fauci had to say on ABC News in response to the president's tweet. Listen to this.
Deaths. I mean, all you need to do is to go out into the trenches, go to the hospitals, see what the healthcare workers are dealing with. They are under very stressed situations. In many areas of the country, the hospital beds are stretched. People are running out of beds, running out of trained personnel who are exhausted right now. That's real. That's not fake. That's real.
Doctor, your thoughts on Dr. Fauci's statements, and then also maybe if you don't mind just addressing the concern that some people have about how deaths are being calculated, whether it is with COVID or from COVID alone. There had been some other reports I think we've discussed before where perhaps someone was inflicted by a gunshot wound and had died, but maybe had had COVID a few weeks before, and it was counted as a COVID death. If you don't mind just sort of breaking this all down for us.
Yeah, there's a couple things to talk about here. And, one of the times I was on this show before, I mentioned that whenever I see confusion about numbers, I always go back to my clinical reality. And my clinical reality is that since March, I have seen many, many people get very, very sick from this virus, and we know that the deaths are not negligible. We know that people are dying from this. In addition, we also know that as time has gone on, our ability to test people, especially in the hospital setting, has really increased. And for the most part, if somebody dies from COVID and it's called a COVID death, they've had a positive COVID test. And the vast majority of the positive COVID tests, the vast majority of the deaths we see attributed to COVID are people who died in a hospital setting with a positive COVID test. So I think always go back to that and put in the context of the clinical reality and the reality you just brought up with California. We're not seeing a bunch of people just have COVID in California and continue living their lives. We're seeing hospitals that are becoming overburdened and full, and they're surging. And so when we think about how do you actually define a COVID death, the way I think about this is, did the fact that this person had COVID lessen their overall life course? A lot of us have other diseases and other medical problems, specifically people who are more prone to dying of COVID or getting sick from COVID are going to be people who have things like cardiovascular disease, heart disease, diabetes. Those are going to be listed on the death certificate as well. Certainly, they are reasons why that patient may have gotten more sick than another person. But the fact that person had COVID is likely what shortened that person's overall life course. And if that was the case, then COVID should be listed and the death should be attributed to the fact that the patient had COVID. Some of this confusion became more apparent because there are another bucket of death certificates out there that has COVID as the only cause of death listed. And if a person has no other medical problems, they don't have the normal things we see in older age people in the United States of America, like diabetes, high blood pressure, and heart disease, but they're a younger person and they only had COVID at the time of their death, then COVID will be the only thing listed. So again, I always go back to the question, did COVID shorten this person's life? And if it did, I think it is completely fair to put that onto the death certificate and count that as a COVID death. So whether the number is 350,000 or 300,000 or 325,000, what we know from clinical reality is that and what we know from our personal experiences by this point, because most of us now in this country have known somebody who has died of COVID or gotten very sick from COVID. So what we do know is the deaths are very high right now in this country, which again goes back to the fact that we've got to get this vaccine rollout going as quickly as possible, because every day that goes by where we don't get these vaccines going into people is another day of hospital surges, hospital capacity problems, and a high death count.
Yeah.
You think about the fact that 50% decrease in transmission after the first 10 days of getting the vaccine. You can just do the math of how many lives that is right there that you can save and how many hospitalizations you can prevent. And then 95% after the 21 or 28 days. That's a huge number of lives. We're talking about per day.
Absolutely. Doctor, we're running out of time, but I appreciate it so much.
Sure.
Really quick question. Have you received the first dose of the vaccine?
I have, and today I go get my second dose of the vaccine. Right after I get off the air with you. I'm heading up to get my number 2 dose.
All right. Well, great to hear. We appreciate you taking the time and joining us beforehand. That's Dr. Jason Wilson. Thanks so much. We appreciate it.
Thanks for having me.
You got it.